Address just for a moment, if I may. First of all, we were included in the strategic plan immediately. Mr. Wrigley and Mr. Negro made a point of having the Boston Consulting Group meet with some high-level executives at the health system, and then also they broke it down and met individually as well. So it was very participatory. The Illinois Medical District, working through the Boston Consulting Group, they listened to what we had to say, and they heard it, and they have been all-inclusive. The district has been extremely collaborative, and we're very grateful for that, because that's how you get the feedback, I think, from everyone that's going to be affected. Digressing just a little bit backwards, my experiences go all the way back to 2009, when I first became CFO the second time for Stroger Hospital, where we were in the middle of a significant transformation process that was being developed, but had to also be rolled out. As part of that initiative, we had a patient access component for which we were really deficient in. And it's like any other business, if you can't take care of your customer will not be happy, and chances are over time, it just creates ill will. To that effect, and then to that point, when I approached the Illinois Medical District the first time back in 2009, the 2020 Ogden lot was it was an agreement entered into where we could use that lot in order to enable us to buy time to be able to develop some additional parking capacity at Stroger Hospital, which was very sorely needed. Now that lot will be part of that RFP that will be developed. But the Cook County Health and Hospital System is extremely grateful for the 4 years of use of that lot, which has benefited not only our patients but also our employees as well. More importantly, the most recent interaction that I've had and that the system has had is with the Medicaid waiver program that we're involved in right now. As Mr. Ridley summarized, it's a very critical component of our existing and ongoing operations and vital for success. I was tasked last year with the responsibility of the financial component for the 1115 waiver around mid-year in the July timeframe. At that time, we needed to be able to establish a base of operations for DHS to be able to set up the operation to be able to process the applications. We were deficient in that space. We could not find enough contiguous space in order to enable that to happen on our campus. When I approached Mr. Ridley and Mr. Negro about it, they offered the use of the 600 South Horn building as an opportunity to be able to do that. And that was a lifesaver, literally a lifesaver, because as some of my colleagues from Cook County, Mr. Herman Brewer and Mr. John Cook, I believe are here in the room today, would attest, getting the lease and get everything put together was no easy feat. But we were able to basically introduce the idea, go through the Cook County Health and Hospital Systems board process, the Cook County board process, and then the actual legal process of being able to lease that building within approximately a little bit over 4 months. And that included the build out of the building to meet the state's requirements. So by any measure, a very rapid but very collaborative endeavor. And if we did not have that opportunity, we would not have a base of operations today. So for that, we are very grateful. We look forward to our continued collaboration with the Illinois Medical District. And we, again, are most appreciative of all the support that we receive. Thank you.
Thank you.
This time I'd like to introduce Dr. Larry Goodman, CEO of Fresh. Goodman, your entire team has been just fantastic to work with. The openness to engage with us has been tremendous, and the challenges that you have asked us to take on that would help you and your team achieve your mission are those that we are grateful, ones that we will work hard to accomplish. We look forward to a long and successful future. Thank you for joining us today.
It's my pleasure, thank you. And Mr. Ridley and President Woodard and commissioners and others. This has been a great process, and we're thrilled to be part of it. The Illinois Medical District represents, I think, a great opportunity. You've outlined a number of aspects of the strategic plan. Translational research is one, but Let me talk a little bit, though, about the strategic planning process from our standpoint. We were very much involved, as you pointed out, and it was hugely welcome. It is a pretty critically important time. I think all of our organizations and the other members of the IMD each have their own set of resources, challenges, and opportunities. And all of us look ahead at trying to execute on those opportunities in the service of the people that we both take care of or train, and see a lot of challenges. And those challenges, I think, are exacerbated to some degree by the economy and by the state of local and federal governments. And it puts a special responsibility, I think, on each of us to prioritize what's really important. We have opportunities, though, in a number of ways. First, we have the potential to be electronically connected and to get data more quickly. And secondly, we have this contiguous group of organizations that themselves are incredibly rich in resources, particularly people resources and intellectual property, and a great heritage of taking care of people and training people. So to see this come together so beautifully under your leadership is really terrific, and we obviously embrace it quite totally. On the research side, maybe today, rather than go into great detail on what a contract research organization could mean or the like, I think that one of the striking things that the Boston Consulting Group identified was that there, I think between 2009 and 2012, there were something like 500 funded principal investigators by the NIH within the IMD, about 700 clinical research trials. About 20% of those included collaboration across organizations. And there's no necessarily ideal number, but often the attractiveness to a program or a clinical trial is the number of patients that might be accrued into that trial. And to join forces in this can really bring great strength to the IMD and really provide a great resource to the people that we take care of, because clinical trials represents an option for people, and it's obviously their choice to participate or not, but it is a tremendous option. Our experience with partnership within the IMD, while somewhat broad, is probably broadest with county and with our affiliation with Strozier Hospital and the creation of the Core Center. So there's one example of something with a public-private partnership that can lead to something quite tangible, managing and taking care of about 6,000 patients with HIV/AIDS, a huge number of research projects coming out of it, and a tremendous vision itself to really eradicate new cases of HIV in Chicago, with 20% of individuals who are infected who don't know they're infected, and any way to identify those individuals with now really easy or highly effective antiretroviral therapy could really wipe out cases. And it's not an unrealistic goal as a premise to say you could get close to. Obviously, there's always importation of cases. It's an important goal. And we know that education isn't enough. It doesn't really quite do it. It really is screening and other new tactics. We've also just today, in front page of the newspaper, the Tribune at least, we've talked about a highly resistant bacteria that is now not only nationwide and worldwide, but has appeared in Chicago, and work done once again across organizations within the IMD, funded by the CDC, that has looked at both how to track this kind of an organism that can cause infections, and for which some subset of them, we have no antibiotics to treat them. So obviously it's extremely important to both isolate them, identify new drugs, new strategies, and new ways of control. And this all starts in partnership. The basic epidemiology requires organizations to share data effectively, and what we've seen in the few cases that have been seen in Chicago with about 2.5% incidence has been a huge amount of movement of patients between our organizations, and the more we can share that data and track it, the more we can protect those patients and others from acquiring disease. And I think the other thing I would say about this partnership gets to the other part of the mission that you've identified, which is economic growth, and a big part of that is jobs. We are not only today, the we is all of us together, a significant economic driver on the west side, but the future of this city depends on people getting jobs, and it depends on training for those jobs. The city colleges have identified healthcare as a major future area of growth, as it's been today, and have changed their curriculum, with Malcolm X College and your neighbor being the healthcare college for the city colleges. And to the degree the IMD can do even more, and already so many of its members are taking Malcolm X students, as the curriculum of Malcolm X changes, this is once again a great partnership, a great way for healthcare organizations can help to train and apprentice students who are in those city colleges really taking advantage of new curricular opportunities, which themselves